हेलो।
हेलो।
हाँ। ओ, ओके ओके। आप
Okay, now am I properly visible?
यस यस, परफेक्ट परफेक्ट।
Now many times it happens like this. So is it okay like this?
नहीं नहीं, दिस इज प्रॉपर। नाउ इट
This is
इज
okay.
प्रॉपर। या
Okay.
इट्स
So that I can, because the presentation will be in front of
प्रॉपर।
me.
या
Okay, I have elevated the level.
ओके ओके, you can slightly lower it because
What?
it's like you can slightly lower your level seat. Yeah, that's fine. I think
Because yeah, maybe when I look at the presentation, it will probably be okay.
right. Okay, I think we'll begin.
Okay, no problem.
Good afternoon, friends. Welcome to today's Pedia Expert Opinion. I'm Dr. Abhijit Sirsak, Medical Advisor, Maxis Division for Alembic Pharmaceuticals. On behalf of Alembic Pharmaceuticals, I warmly welcome you to today's Pedia Expert Opinion. We have an eminent speaker in midst of us, Dr. Pramod Zog. He is a professor of pediatrics at D.Y. Patil Medical College, Pune. He has served as the president of Indian Academy of Pediatrics for the year 2016. He was a standing committee member of International Pediatric Association 2016 to 2019. He's also a senior consultant to UNICEF, and he is a chief editor for Time of Pediatrics. So today he will be talking on the topic of conquering the current crisis. So I hand over the session to Dr. Pramod. Welcome, sir.
Okay. So, my dear friends, we will be discussing about conquering the current crisis. And we had the designation has been changed to BC. And IAP stands for Intelligence Application. So I will speak on all of the colleagues who are of normal IQ, and everybody these days has an degree of FCS, fever, and I am not in high risk category. I am immunocompetent, and I would request you to follow certain rules when you go for practice, which I will cover during my talk. I have been a student since deeply involved in the investigations of fever, in the epidemics of dengue and various places, and I was also a key student of the SARS epidemic which occurred in 2002 to 3. I will mention all these facts as we proceed further. Now, my dear friends, I just just a minute. I said, this particular disease has been a universal calamity, and many of our colleagues have already started getting some withdrawal symptoms. The doctors who have practiced or patients they are getting only 20, or some of them are in only 2 patients. And there are other causes of withdrawal symptoms, but our colleagues are getting withdrawal symptoms because of practice. The medicine has come down, the pharma sales come down, and so many products are now, in this situation, it is important that we remember trust is a symbol of doctors and we have to be positive and not COVID-19 positive.
जितनी भी आपने दूसरी एप्लीकेशन से खुली हुई है ना, उन सबको बंद कर दीजिए। सिर्फ अपना प्रेजेंटेशन ओपन रखिए और इसके अलावा सब कुछ बंद कर दीजिए। इस लिंक को, हाँ, आप उस लिंक को एक बार ओपन कर लीजिए। हाँ, वो ओपन होगी सर?
हाँ, मैंने तो अभी ज्वाइन वेबिनार कर रहा हूँ।
हाँ, और पीछे क्रोम है ना, उसको भी बंद कर दीजिएगा सर।
ओके,
जो क्रोम खोला है ना, उसे भी बंद कर दीजिएगा।
हेलो,
हाँ, आप सही है। अब आप प्रेजेंटेशन शेयर करके कुछ बोलिए और कैमरा भी ऑन कर दीजिए सर।
अभी शेयर स्क्रीन करूं?
हाँ, और कैमरा ऑन कर दीजिए सर सबसे पहले।
हाँ, किया।
हाँ, अब आप शेयर स्क्रीन कर दीजिए।
एक मिनट, अब शेयर, अभी
आपका वीडियो चला गया, आपने वीडियो बंद कर दिया। हाँ, नीचे ग्रीन बटन।
हाँ, किया ना? हाँ, ठीक है।
हाँ,
ओके, अभी दिखाई दे रहा है?
ओपन होगा। हाँ, उसमें आपका प्रेजेंटेशन ओपन होगा।
अभी प्रेजेंटेशन ही नहीं है सामने मेरे।
प्रेजेंटेशन ओपन किया हुआ है आपने या नहीं?
नहीं, प्रेजेंटेशन तो वो था, वो इसने एनी डेस्क पे किया था ना हमने।
नहीं, वो मैंने आपका प्रेजेंटेशन आपको वापस से ऑन ही है ना, देख लीजिए एक बार।
हाँ है, हाँ है।
हाँ,
हाँ,
बस।
अब वो मैं वापस उल्टा हो जाता हूँ. I will go back.
हाँ उसको फुल स्क्रीन कर दीजिए एक बार.
एक मिनट. हाँ, अब मैं फुल स्क्रीन कर देता हूँ. ठीक है.
हाँ ठीक है, मुझे आपका 1 मिनट रुकिए.
हो गया. तो I will now go back to the first one.
हाँ अब सही है, आप कर.
अब आवाज आ रही है.
एकदम सही.
So now I will start from beginning.
Yes, sir.
1 minute. Huh? Okay, so there was some technical problem. So we will start the discussion again. Okay. Very good. So, my dear friends, we will be discussing about the topic called conquering the current crisis. And today is 17th April 2020, and that is AC, that is after Corona. Just as we had earlier distinguished between before Christ and after Christ, now this is before Corona and after Corona. If you look at my degrees, this talk will be for the IAP members. These are the intelligence wise average pediatricians. And these days, everybody has to have one additional degree, and that is FCCS, that is fever, cough, and corona specialist. So, at least for the next many months, you must know a lot about this current disease. Remember, I am less than 65 years in age, and that's why not in the high risk category. And I am also immunocompetent. Remember, I have been a student of epidemics and pandemics for a long time, and I was deeply involved in the investigations of epidemics related to the resistant enteric fever, dengue epidemics all over the country. And I have also been a keen student of epidemics of SARS, which occurred in 2002 and 2003. Now, most important is that this particular problem of COVID-19 has been a universal calamity. And because of this calamity, many of our colleagues have started developing withdrawal symptoms. Of course, withdrawal symptoms are also because of many other things, because of the indoor habitat of some of our colleagues. But this particular pandemic has stranded people at homes. The immunization has gone down, the pharma sales have gone down, and so many problems are there. But we will not be negative, because our symbol is plus, and we have to be positive. Of course, not COVID-19 positive, but we have to be mentally positive. Okay. And every pandemic is a great teacher. This particular pandemic has taught us courage. It has given us an opportunity to read the literature on the disease. It has taught us to reflect about our life. We have started thinking whether our daily needs are really that much, or whether we can minimize our needs. And it has also taught us to observe discipline, and it has also brought us nearer to our dear ones and the family. And it has been a teacher, because now we can anticipate and prepare for the future crisis. Many people say go corona go, but I would say no corona no. So, and you must know quite a few things about this coronavirus, which is known as cov. It's a large family of viruses, and basically the illness ranges from common cold to more severe diseases. And this novel coronavirus is a new strain. It's a mutant that has not been previously identified in the human beings. And there are three crooked corona brothers. I will tell you the one that I mentioned to earlier, 2002, 2003, that particular SARS-CoV, that was first one. That was severe acute respiratory syndrome related to the same coronavirus. Then in 2012-13, there was Middle East respiratory syndrome, coronavirus only. And the third one is the current one, that is the COVID-19, that is 2019. It's a novel coronavirus. And why it is called novel? Because you can see that there are spikes outside. Those yellow colored ones are the ones, these are the spikes. And that gives the appearance of corona. That is the mukut, that is the crown. And that's why it is to be understood properly. And let us go down the history when it's all started on 31st of December, when some of us were enjoying the year end. And this is the timeline. Remember, 31st December, China alerted WHO to a case of several pneumonia cases all over in China. And then on 7th of January, France confirmed Europe's first case. Then China announced the first death on January 11. Then WHO reported a case in Thailand, the first outside China, on January 13. 23rd of January, China declared the lockdown. And then on February 11th, WHO named this virus as COVID 19. And this particular timeline now is known to many of us, but one must remember that in this particular span, United States, Italy, and Spain have been always involved. And now India is also showing rise of cases, though steadily. That's why, remember, it's a serious and a treacherous virus. Why treacherous? Because sometimes children can carry the virus without people knowing in front that this particular child is carrying the virus. Some of them are asymptomatic, and we'll come to that. And remember, the name itself contains R, N, and A, and it's an RNA virus. It has its own peculiarities as an RNA virus. What exactly happens is that it comes out during the coughing and sneezing, and it spreads up to about 6 feet, and the incubation period on an average is about 5 days, though it can go on up to 14 days. And there are different ways of transmission. It can get transmitted as aerosol droplets, which are generated during nebulization or when a person coughs or sneezes. So these are small particles. And physical contact, whenever a person comes in contact with other person, or when a person touches any surface, maybe a metal surface or a plastic or a stainless steel, it can stay there. It can also transmit through fecal-oral route and also the airborne route. Now if you see, when a person coughs, the velocity is about 10 meters per second, while when a person sneezes, the velocity is much more, 50 meters per second. So when you sneeze, the particles, the spray of the droplets is at a longer distance, even up to 6 meters. And that's why you have to be careful. When a person coughs, it can go up to about 2 meters. And that's why we say that the distance between one person and the other person has to be about 6 feet. And the physical contact, which I mentioned earlier, relates to the virus, which can survive on the plastic, particularly the mobile phones, the laptops, the bottles, the stethoscopes, for 72 hours. On the stainless steel, it can survive for 48 hours. And on the cardboard for 24 hours. And in the copper vessels, it can survive for 4 hours. And this contagiousness is expressed by what is called as R naught. And that is the basic reproduction number on an average as to how many people each infected person will in turn infect in a fully susceptible population. That means more this R naught, more is the contagiousness. This is, like for example, measles, it is highly contagious. And that's why this particular contagiousness is expressed in the terms of R naught, which is around 3 for this particular virus. Okay. And what it does is it produces immune dysfunction. The dysfunction goes into two phases. In the initial 4 to 5 days, this virus will set up an immune response. And if a person is healthy and has a good immune system, he or she will overcome this particular disease. However, after 4 or 5 days, if in case the person has not a very good immune system, then the cytokines which are released in the body, usually they are called as pro-inflammatory cytokines. That means they will increase the inflammatory process. Okay. And after 5 to 6 days, basically, the person will start developing problems. Some of them, they go and develop what is called as a cytokine storm. That means large number of cytokines, which will have impact mainly on the alveoli, and that can lead to severe problems in the lung. So I always say that one must pray the God, that the God should give us cytokines which are enough to control the problem in the initial part of the disease, and not so many as to create a problem in future. I always, compare it with our companion. When we get married, our husband or wife, whosoever it is, we always should pray that give me a companion who would fight, no problem, but only up to one particular level, and not fight up to the level that we get a divorce. So same is true about this particular immune dysfunction. Okay. Now, every disease basically goes on with an epidemiological triangle. What do you mean by that? That it's an interaction between the host, agent, and the environment. Host means the human beings. So we say that, there is a feeling that in certain countries, including India, probably the virus is acting differently because of our genetic makeup, maybe some other factors. agent, that is the virus, probably, has a different behavior in different countries. And environment, like for example, the temperature, various temperatures, the virus may differ in their behavior. So it's an interaction between the host, agent, and environment, and that decides the epidemiology of the disease. That means how many cases would occur and how long the epidemic or the pandemic would continue. Fortunately, the pediatric cases, that means the case is usually mild, and they are mainly the family cluster cases, meaning thereby, they have link with the adult patients. And the maternal and the neonatal infections have been reported, but the youngest reported so far is only 30 hours old in China. And the clinical features in children, are that the children could be asymptomatic. 90 to 95% have mild disease, including the neonates. And the usual symptoms, as we will see, they are related to either fever or cough, sneezing, myalgia, sore throat, fatigue, vomiting, diarrhea, and abdominal pain. Some of these are abdominal symptoms, and wheezing. And 5% have severe disease with pneumonia, ARDS, and shock. And less than 1%, they require mechanical ventilation. The first critically ill child in Wuhan actually, presented with recurrent diarrhea and vomiting. And the first two samples on admission were negative for this virus, but the third sample tested positive. The child came out even after being critically ill for quite some time. And as I said, the good news for pediatricians is that COVID-19 below 19 years of age is mild in majority of the cases. However, it's quite puzzling to know as to why the disease is milder in children. It is not completely known, and the possible hypothesis says that children get exposed to viruses so often in the first year of life, to RSV, to rhinovirus, and so many others, that it boosts the immune system. And children are used to respond to these viruses, and corona is not an exception. Some people earlier thought that BCG probably gives protection against this virus, but now this doesn't hold true anymore. And immunizations, many of us, those who are actively involved in immunizing children, we are giving every antigen at 6 weeks, 10 weeks, 14 weeks, 6 months, 9 months. The body gets tuned to respond to these antigens, and that's why children are good responders of immune system. And then higher expression of these ACE2 receptors, which could be protective, and higher lymphocyte count in children, and inability to mount a cytokine storm. So some of these are the factors which are proposed as to why the disease is milder in children. Remember, most of the pediatric patients have recovered within 1 or 2 weeks after onset, and it is very uncommon to progress to the lower respiratory tract infections. The disease usually remains restricted to the upper respiratory tract. And I was referring to some of these symptoms. The percentage of fever is almost 88%, and dry cough is seen in about 68% patients. And if you can see at the bottom, nausea, vomiting, and diarrhea, they are also seen to a total of about 10%. Okay. Roughly, there have been 3 stages of the disease, wherein either there is pneumonia or no pneumonia. So if it is stage 1, no pneumonia. Stage 2, it is moderate, and that is only pneumonia. And if it is severe pneumonia, then it goes into stage 3. So stage 1, no pneumonia. Stage 2, moderate pneumonia. Stage 3, severe pneumonia. This is simplification so that our listeners understand in a better way. And the course is such that dyspnea, that is increase in the respiratory rate, it develops after about 5 days after the onset of symptoms, and the hospital admissions occur after about 7 days of occurrence of the symptoms. And those who are hospitalized, they have different complications like arrhythmias, superadded infections, or other viral co-infections. And as I said, about a few, they develop ARDS, and some of them can develop renal injuries, cardiomyopathy, and recovery time is about 2 weeks for mild infections, and 3 to 6 weeks for the severe diseases. And there are some poor prognostic indicators, though some of them are related to the adults. Remember, those who are above 65 are more, rather their seriousness is more in this group. 70 to 79 years age, the case fatality rate is about 8%, and above 80 years, the case fatality rate is 15%. It affects males more, and the comorbidities like hypertension, the pulmonary disease, and diabetes, and malignancy and immunosuppression, these are the poor prognostic indicators. And if at all you ask me as to how I differentiate this virus from other respiratory viruses, remember, it is indistinguishable from other respiratory illnesses. You cannot differentiate it from flu and so many other respiratory viruses. And that's why these days it's a dictum that any child coming for fever and cough or cold, has to be taken as COVID-19 positive unless proved otherwise. And you have to be careful. As I told you, if you want to differentiate from flu, the incubation period of flu is much shorter. But I told you the incubation period of corona could very well extend up to 14 days. The mortality of flu is about 0.1%, but for COVID-19, it is about 3%. And remember, flu many times presents with runny nose, which has been said that for corona is not a very very prominent feature. Dry cough has been a major present feature. And in the neonates, remember the clinical symptoms like refusal of feeds, hyperthermia or hypothermia, shortness of breath, that is the clinical symptoms. Then the chest x-ray, and a positive case in the family or a close contact with pneumonia. Some of these factors are required if you want to define and definitely suspect a neonate who is likely to have this particular infection. Now let us see as to when a child comes to our OPD with fever, you have to be very very clear. First thing, you ask the parents whether the child is active, playful, eating well, sleeping well, or the child is sick, meaning thereby not eating well, not his usual self, and not sleeping well, and looking dull. So, you have to first have a mental triage. That is what is called, that is the classification mentally, whether the child is active or sick. And number two, see whether there is any focus, particularly if a child has some boil on the skin, or if a child has a complaint of dysuria along with fever, then obviously you can have localization of the illness to some particular system. But if a child doesn't have any localization, if he is okay, playful, don't worry, just give them paracetamol and antihistaminic and let them go home and report to you telephonically after 2 days. Usually I tell them only to report telephonically. If at all the child worsens during these 1 or 2 days, then I tell them not to come back to the clinic, but if possible to show the nearby pediatrician or a family physician so that he can direct them to the government hospital or a COVID designated hospital. So remember, whenever a child comes to you for the first time, it's okay, but then don't call him if he becomes more sick. Either you directly send him or give them an instruction, directly go to the COVID designated hospital. Remember, important point, we will come to as to how to handle these patients when they come to the clinic, but some of these things these days could be done very well on the telephonic advice. But most important is to tell them to report to you if the child develops increase in the respiratory rate. If the movements of the chest and the abdomen are more, that means the child has increase in the respiratory rate, then you please tell them to proceed to the government hospital immediately without wasting time. When the child presents to you, if at all he is sick at that very moment, then it is your moral duty to refer this particular child these days to a COVID designated hospital or to a government hospital. Remember that measurement of fever is very important. In the house, parents can very well use a digital thermometer, and this digital thermometer should be used only for the child. Okay, and afterwards it has to be sterilized, and then only it has to be used for either other child or other person in the family. In the hospital, you have to measure the temperature, and even in the clinic, so that you can do by a thermal scanner, or if you have some other infrared thermometer which you can use. There are many limitations of these infrared thermometers. However, at this particular juncture, we do not want to touch the child, and as far as possible reduce the touch part of it. And that is the reason why we don't want to examine the throat of the child. You don't want to examine the child with a very close distance and all. There are limitations for every point in the examination, but you have to take all the possible precautions. And for a child with fever and cough, as I said, you have to remember that it could be corona unless proved otherwise. And in this particular situation, it is necessary that we as physicians and pediatricians also should put some control on ourselves. Of course, if your practice has been very minimum even before this particular pandemic, then there is no question of going to the clinic. You better take a rest at home. If it was okay, like, and if you really want to go to the clinic, then you decide. If you are above 65, wait. If you are hypertensive, wait. If you are diabetic, wait. If you are on having any anti-malignancy agents, wait. So there are many factors. If you are yourself sick or ill, please don't go to the clinic. Remember, it is better to apply all these tests and then decide whether you really need to go to the clinic. Some doctors are saying, अरे अब क्या है now, so many days I have been sitting home, how do I earn, and what would happen to my practice and all. So I tell them, shir salamat to pagdi 50. In case for next few days, weeks, whatever it is, in case if you remain healthy and well, then only it's okay. So you have to take a call depending on your situation. However, as doctors, as I said earlier, we have to be positive. It is our moral responsibility. We have taken an oath that we will definitely serve the patients, and that's why it is moral responsibility to go to the clinic if you do not have any risk factors. This is very clear, and you can decide on your own. In fact, you can take this particular opportunity to start going to the clinic on your bicycle. That is because many times, because you are eating, simply eating at your house, it is possible that at the end of this lockdown period you might become obese, and that's why the best way is to go by on a bicycle to the clinic. These days the patients also do not mind even if you go a little late here and there. So it will also give you an additional exercise. And try and handle as many consultations on teleconsult. What is this teleconsult? It means that the patient calls you. Yes, Dr. Joe, my son has fever and the child also has cough. Okay. So Dr. Joe says, okay, put on your video related to the WhatsApp. Okay. And then just use the back camera of the mobile. Okay. Now show me the throat of the child. Okay. Are there follicles on the tonsils? You can make it out. Then you tell the parents to touch the part below the mandible and just see whether there is any tenderness of a node. Okay, so you have noted that there is a follicle on the tonsil and also there is a tender node. Also ask them to record the temperature and tell you. So now you have a lot of information. The child has fever, a bad throat with follicles, and a tender node. So you can always give him antibiotic and some antipyretic agent. You can also ask them to move the camera all over the body and show whether there is any rash. Okay, so there are many things which you can give a consult to, because all those things like the examination of the throat, direct examination in the clinic, now they are likely to be away for some time, and teleconsultation mainly involves only inspection. You cannot undertake this palpation and percussion and auscultation and all. Of course there are some other instruments which could probably guide you on that, but for a common average pediatrician, I think these things should be enough. One of my friends says that if a person calls you and if everything is fine and there is no major problem, the only advice one should give on telephone is water. For fever, it is tepid sponging with water. For cough, it is warm water with honey. For constipation, also it is water. For diarrhea, also it is water with ORS. Of course, jokes apart, just remember that the teleconsult slowly and gradually will become the major part of our consultation. However, one has to be very clear that this consultation can be given only by the registered medical practitioners, and you have to undertake a course of telemedicine at least after this particular problem comes under control. As of now, MCI has allowed you to give teleconsultation, but you have to be very careful that the video which you are using for teleconsultation has a good quality, and you also have to have the consent of the patients in the format, so that you can always tell him that there are limitations of this particular mode of therapy, what you may say media therapy. Okay, and you have to be very clear that in case if the child doesn't improve, you have to bring the child to me. If a child is less than 3 months, neonate, a sick child and all, then it is better not to give them teleconsult. Ask them to come to the clinic. And remember that when you start going to the clinic, divide the OPD into two halves. If you are going to work for 2 hours, let the first half be for immunization and second half for the ill patients. Okay, I always ask them to come by prior appointment and come in their own vehicle, because if they wait for a cab or some other vehicle, it is possible that the earlier vehicle might have been infected by a virus, and that's why it is better to come only if you have your own vehicle. As far as possible, I encourage them to show to the nearby pediatrician or to the family physician. And in case if they come to the clinic, then I ask them to wait till their turn comes outside the chamber, or some of them who have their own cars, they can sit in the car and the receptionist calls them whenever their turn comes. And the next patient is taken in only when the first one goes out. This is very, very clear. And at the time of entry, I have arranged for a hand wash and a sanitizer before their entry. I also kept some masks at the entrance before they enter. If they bring their own masks, well and good. And I allow only one relative to enter into the clinic. The waiting room has to be very well ventilated, because the virus will get dissipated fast if there is a good ventilation. It doesn't stay longer when there is a good ventilation. I have removed all the chairs from the clinic so that people don't have a temptation of sitting, because our people are used to sit, because doctors usually come late to the clinic, so they want to sit. But now doctors also have to come on time. That's why you have to be very, very careful about the sitting arrangement. And the receptionist also must wear a mask, also have a sanitizer at her disposal, and wear gloves and maintain a 6 feet distance from the relatives and the patients. And if the visit is necessary, then we give a proper time slot. Suppose if it is 10:30, next one comes at 10:45. Okay. And the mask which the relatives wear could very well be of cloth, or it could be homemade also, because basically it's a mask which is worn by the relatives who are not infective. Okay. In case if the patient is a walk-in patient, that means he had directly come out, I put up a board outside requesting them to call before entering next time. And also the health educational material which was inside in the waiting room, now it has been shifted outside. And I have a luxury of having one or two additional rooms, so those with respiratory complaints, I usually segregate them into a separate room. And the well baby visits are at a different time altogether. But as of now, the initial half of my consultation I am using for the immunization practice. Now, for the income wise average pediatricians, remember that the personal protective equipment, these are again different types of IAP members. They include a mask, an apron, and non sterile gloves. Remember not to let the mask hang from the neck and not to touch the outside of the mask. Whatever tea, coffee, water you want to drink, you drink it and then put on the mask. Intermittently, you should not just lower the mask, then scratch the nose, scratch the head, not allowed. So avoid drinking tea and coffee and water in between. I will tell you about the masks in a minute. And if possible, you can use goggles which would cover the sides of the eye also. And gloves are not the latex gloves which we have seen all throughout these years, because the virus is known to adhere to this latex. So there are nitrile gloves which look blue in color, and you use them. They're not very costly. The wholesale rate is roughly 350 rupees for 100 gloves. That's okay. You can use it during one session in the OPD. And you can use a head shield, one which would cover the entire front part of your face, so that even if the child or the relatives they cough, directly the virus won't go and sit on your face. Remember that the effectiveness of the preventive steps has to be well understood by our colleagues. So, at the time of this SARS epidemic, this virus transmission reduction of the risk was studied. Hand washing alone reduced by 55%. If you combine hand washing plus wearing of the mask, it is reduced by 68%. And if you have hand washing, wearing of the mask, gloves, and protective gear, then it is 91%. So, more the merrier. And I just wanted to show you that the virus basically the one which is seen in the pink form, these are the droplets in the nasopharynx, then in the bronchi and in the alveoli. Remember that the ones which are larger than 10 micrometers, they are stuck in the upper respiratory tract and they can be blocked by the surgical mask. However, the ones which are smaller than 10 micrometers, these are the aerosols which reach down to the lower lung, they are blocked efficiently only by the N95 filter. And that's why you have to, as far as possible, wear N95 filter. You really do not know as to who is the patient in front of you, and that's why it is prudent and wise to use an N95 mask. I will just tell you as to which mask is more effective. Now you can see in the first picture, it's a single layer mask. In the second one, it is a surgical mask. And in the last one is the N95 mask. Now the single layer face mask, he has only a single layer of non-woven fabric or a wood pulp tissue paper. And it is used in the food processing industry. And it doesn't give protection against corona and it is not recommended. Okay, the surgical mask or the medical mask, it has three layers. The innermost layer is an absorbent material that absorbs the moisture from the breath of the wearer. The middle layer is the one made up of melt blown material which acts as a filter, and the outer layer is of the material that repels the virus. Okay, and the pleats which are there, they are intended to increase the surface. And the problem is that it does not offer tight fit to the face, and it is not preferred for self protection. However, it is good for those who have active problem of coughing and others, and basically it will prevent transmission outside from that particular person. While the N95 mask, basically it's a tight fitting mask with a filtration system, and there are millions of microfibers of polypropylene layered on top of each other which are electrostatically charged, and it can filter 95% of the particles. Okay, now the point is that the coronavirus is 0.14 microns. And you will ask me as to if at all these N95 masks can filter only up to 3 microns, then how a coronavirus which is 0.44 microns can be filtered. The reason is that the coronavirus has a Brownian motion. Brownian motion means thereby it will have a movement like this: up down, left, right, everywhere. And that is why the virus is trapped in the mask. That is what one should remember. And if you are actively involved in the care of a patient who is COVID positive, N95 mask is a must along with other personal protective equipment. And that's why in the community, people can move around with a simple cloth mask. If a person is infected, he should wear a surgical mask. And in the non-aerosol generating hospital settings, you can use surgical mask. But in case if you are in a setting where there is an aerosol generating setting, like you are giving non-invasive ventilation, nebulization, where aerosols are generated, N95 mask has to be used. But the bottom line is that everybody should wear a mask. And one important point is that it is extremely important that you wear a mask. And if you see this graph, remember, you can see that the countries that have a culture of wearing a mask regularly, you can see those are the Japan, Singapore, and Hong Kong. The epidemic has not taken a big shape. However, countries that do not have a culture of wearing a mask regularly, like China, Italy, Spain, and UK, basically the epidemic has taken a very, very grave form. So it is important that the masks are worn by most of the people most of the time. Okay, and this is something about the sterilization of the mask. It has to be sterilized either by air drying, that means for 48 to 72 hours in clean and a dry place you can keep it, or keep in a breathable paper bag and avoid direct sunlight and the UV rays. It can be heated in an oven and hung up in the oven for 30 minutes at 70 degrees Celsius. However, the problem is in the oven, this N95 mask, which has a metal clip, can have a problem. Or you can use a dry heat in the rice cooker without water for 3 minutes, and it can be chemically sterilized with H2O2 or ETO. Of course, remember, if you have a beard, the particular type of beard cannot have proper fitting of the mask, and that's why you have to trim your beard. Okay. Now there is a lot of discussion about this novel queen and that is the hydroxychloroquine. And prophylaxis has to be taken by those who are going to handle the patients who are COVID-19 positive, and those who do not know as to whether they are dealing with these patients in front of them, because it is prophylaxis. I, for myself, I have taken hydroxychloroquine 400 milligrams twice daily on day one, and now every week I am taking 400 milligrams weekly for 7 weeks. People are worried about gastritis and many other things, and is QT interval and others, but don't worry about it. It's not something very common. And take it at night before you go to bed, so that you are not worried about gastritis and all. Once you go to bed, you won't understand. Okay, so remember, better you take it. And clinic during this corona era, as I told you, when you deal with the patients, keep a distance of 1 meter. Now, how to examine children? So keep the baby or a child in the mom's lap or chair, but avoid the table. Many of us have a habit of putting the baby on the table and examining, but now you have to keep the child in the mom's lap. However, it is very difficult to maintain a distance of 6 feet. Otherwise, how to examine the child? And that's why there are some limitations. But it is better that you keep as much distance as possible. And unnecessary investigation of the throat and the chest by the hospitalization is not required. Majority of the diseases by now you can identify, and there are many parents who come for immunization and for some other reason, and they insist on checking the weight and the height and the head circumference. All these days nobody bothered to check all these, and now only during this pandemic they are insisting on weight and other things. So just use approximate weight. Tell them till the lockdown is over, we are not going to do all these detailed exam. As early as possible you better go back to your home, and please do not weigh on a common scale. Remember that the examination has to be very quick. In case if you find that the child has fever going on for 4 or 5 days, please do the pulse oximetry. It has been found that those who have fever for 4 or 5 days, particularly in the adults, in a very short time they progress to fast breathing and problems. So at day 5, there are our adult physician colleagues who go on for hemogram, the measurement of CRP and pulse oximetry and a chest X-ray. Though this may not be, rather extendable to pediatric population, please remember pulse ox is something which is important, because many times the child may appear well, but saturation may be below 90 or 88, and that's why you have to be very, very clear. But do not forget to clean all these equipments when you go back from the clinic: the stethoscope, the thermometer, the pulse ox, everything. Okay. In case if the child in front of you has temperature and tachypnea, please immediately refer him to the facility for testing. Okay. I told you to avoid throat exam, and disinfect the instruments before you leave the clinic and also in between the patients. And keep all these things separately at separate clinics. Also keep your pen and your own personal belongings at the clinic itself. Do not carry the stethoscope and the pen along with you when you leave the clinic. And after every patient you can use hand hygiene on the gloves. And once you are leaving the clinic, it is better to disinfect the clinic floor and the equipments with 1% sodium hypochlorite. It is very important, because this virus is very, very susceptible to this bleaching powder. Within a minute the virus is destroyed. Okay. And no nebulization for a child coming with cough these days. Only you have to use the other equipment, the inhalers, with the instrument, but no nebulization. As I told you about some investigations for a serious child, I will tell you as to what do we do about immunization. Remember, currently, whenever a child takes birth at a maternity home, that is the best place where he can receive his initial vaccines, that is the hepatitis B, oral polio, and BCG. Uh, the child who took birth either in January or February or March, slowly and gradually will now go and become 6 week old or 10 week old or 14 weeks old. And that's why you must remember that you will be asked by the parents as to what do I do about immunization. Our Indian Academy of Pediatrics has given clear guidelines that these children must receive the vaccine as per the schedule, no delay. Okay. Coronavirus has no connection with this immunization. Neither the immunization process has anything to do with the virus, and that's why it is important. Remember, rotavirus vaccine is also given at 6, 10, and 14 weeks, and there is a strict schedule for rotavirus vaccine. The first dose has to be given before 16 weeks. So you cannot skip that. The second dose of rota is given before 32 weeks. That also you cannot skip. So have to follow. Pneumococcal vaccine is also given at 6, 10, and 14 weeks, and influenza vaccine, which is given at 6 and 7 months, and MMR vaccine. And in the government setup, the MR vaccine, they are given at the age of 9 months. So remember, pneumococcus, flu, and measles, these are respiratory pathogens, and it is quite possible that a child coming to you can contract some of these infections, and they may complicate the current situation, and that's why you don't want that the child gets additional infection with these 2 3 pathogens. And that's why you be clear and follow the schedule which has been laid down for our children. Remember, the chicken pox cases also have started coming up with the onset of summer, and that's why you must give the dose of chicken pox vaccine, which is given at 15 months. So by and large, children must receive all the vaccines up to the age of 15 months as per the schedule. Please do not change. We have been striving hard right from 1985 to bring polio under control. We have been striving hard by mass campaigns to bring down measles over last so many years. We do not want to waste all our efforts, simply by delaying the immunization. Otherwise, the number of susceptibles in the community will increase, and we will have tough time handling these diseases rather than the coronavirus. And that's why you have to be very clear. So please do not refuse any child coming to you for immunization. Of course, along with immunization, HE vaccine is important. What is HE? That is health education. And the other day, we were just sitting and creating some slogans, and then some of our colleagues probably came out with some slogans like, मास्क लगाना बेहतर है वेंटिलेटर के मास्क लगाने से, घर पर रहना बेहतर है आईसीयू में रहने से, और बार बार हाथ धोना अच्छा है जिंदगी से हाथ धोने से. So some of these slogans are important, and you better tell the parents that it is important to follow all these precautionary measures. The prescription, when you give it to any parent, has to mention two things. One, danger signs explained, and number two, nasopharyngeal swab SOS. These two are important. So later on, parents need not say anything. In fact, at the entrance, when the patients come, we have a regular format wherein we read it out to the parents and take a signature saying that I fully understand that there's a pandemic going on, and I have come in good faith to the doctor. And in case if my child develops some symptoms, or he worsens or becomes COVID positive, I will not hold doctor responsible for anything in future. So it is better that you take the written consent before you go for examination of any child. It is better. Okay. And as I told you, before leaving the clinic, you have to take care of many things. Number one is you have to take care of the cash currency. What to do? Because there have been conflicting reports as to whether paper is something which transmits the virus. Some people say it doesn't, but really nobody knows about it. So what I have done is that outside in the clinic, I have kept a cardboard box into which I request those patients who want to pay only by cash to put it inside. Of course, I make it doubly sure that they put only the cash and not the leaves and the flowers, which as if they are offering to the god in the temple. And then at the end of the entire session, whatever is the cash, usually I requested the reception person to wash the hands and then take out the cash currency, put it on a cloth, put another cloth onto the top, and iron properly by using the iron which we use for ironing our clothes. It is known that the virus is killed by heating and by 70% alcohol. However, we cannot use alcohol for the cash, and that's why heat is the best way, and then the cash could be taken by you. Also remember to remove your apron. Some doctors are taking pride in moving on the roads with aprons. Probably they want the police to know that they are not the common men, and that's why they should not be obstructed by the police. But it's better not to move around with an apron, because when they are moving around, they might be spreading COVID-19 loaded, these viruses could be there on the aprons. You have to be very, very careful. Okay. What I do is that I have kept two sets of clothes in my clinic. So when I leave the clinic, I go to the changing room, I remove the apron, put it directly in a separate bucket, and ask the attendant to clean it in hot water. I change my dress totally, and then without touching many things in the clinic, I go back to my house. Remember, when you leave the clinic, follow the principle DTH, direct to home. Please do not go anywhere else from the clinic, directly go home. Before you enter, you remove the shoes outside, and also keep all the accessories like the watch, the mobile phone, the keys, the specs, everything, the belt. You put it in a separate bucket, and then you enter only with clothes, bare feet, and keep your hands away, both the hands extended. Do not touch anyone, do not hug anyone. Directly go to the washroom, remove the clothes, put them in hot water bucket again, take a shower bath, then come outside, wear new clothes, and then you hug whomsoever you want to hug. Remember, I also give a ring from my clinic when I go home, that keep the doors open, I am coming, and that is important, because otherwise you have to ring the bell, touch the bell again, you have to see that the people open the door, and so many other things. So I give them prior intimation that I am coming home. This is important. And there are parents, your parents, who are vulnerable, there are children around, and that's why you have to maintain distance. And remember, some of our colleagues, they many times they start getting a feeling as if they have sore throat or they are having fever. For them, I would suggest that you better keep a thermometer with you in the house and check it, because psychologically many of us feel, oh, now the pandemic is going on, oh, I had been to the clinic and whether I caught it and all. So don't worry, it is better that you check and confirm. And it is prudent and wise to do some gargles with hot water, though there may not be any scientific evidence to this milk with haldi, though there may not be any scientific evidence, but there is nothing lost in following some of these things if it is okay with you. And then, as I told you, the pillars of prevention include washing hands regularly during daytime with soap and water for 20 seconds, okay, or using an alcohol containing disinfectant with at least 60% alcohol, ideally 70%, wearing a mask, following cough etiquettes. When someone coughs, you have to tell him to cough in the elbow like this. He has to turn the head on one side and cough in the elbow, because elbow usually doesn't come in contact with the things in front. And follow social distancing of 6 feet. Remember, there are many things, I call them as hasta pancha sutri, 5 things related to the hand washing, hand folding, that is namaste. There are different types of namaste. One of them is where there is obtuse angle between the hand and the forearm. This is usually done by when you meet somebody. There is another which is a right angle. This is usually done by the air hostesses. And then there is this one, which we do it either to people whom we respect a lot. And that's why you have to remember the types of namaste, but then any type is okay, but no handshake. And keep the other person at a hand's distance, your hand and his hand, totally it comes to about 6 feet. Avoid touching the face, nose, and the eyes with your hand. And use a handkerchief, but see that the handkerchief is properly disposed of in the dustbin. Now, the steps for washing the hands are many times not remembered, and that's why this is a small mnemonic called samman. What is samman? Sulta, that is the front side; ulta, that is the back side of the hand; mutti, that is the fist; mangat, that is the kalai; angutha, that is the uh, thumb; and nakhun, that is the tip of the fingers. So remember samman, so that you don't forget all the steps, and you have to follow them and wash the hands for 20 seconds. Okay, I told you about certain lab tests. Remember, the tests are done at the COVID designated hospitals or certain labs, and this RT-PCR is the test which is used. It has a sensitivity of to 80%, and in the initial 3 to 4 days, usually the tests, they don't come positive. So basically, you do these tests after 5 days. There are also false negative reports in the early part of the disease, and that's why you have to repeat the swab in about 23% of the patients. Okay, of course, if the tests come positive for other respiratory viruses, it's in fact, then it does not prove that he is negative to COVID-19. but it might reduce the index of suspicion substantially. Okay, so it is better to read the test in between the lines. And there have been various guidances from ICMR about the antibody kits. We will not go into the details of the antibody tests, but whether the PCR or whether IgM positive, please at this particular juncture take that they are positive COVID-19 cases. Okay, I told you something about the lab earlier. And in adults there is leukopenia and lymphopenia, though it is not that much correlated with children. There are increases in the liver function test enzymes also. As I told you, in the second immune phase there is macrophage activation and increase in the pro-inflammatory cytokines, the increase in the level of D dimer, CRP, LDH, IL-6, ferritin. All these are indicators of the latter part, and they go on with the severity of the disease. Remember, there has been a lot of discussion about PCT, that is procalcitonin, and by and large, many people feel that this is one condition where CRP is high. We know that in many conditions which are viral infections, CRP is usually normal, but this is one condition where CRP is high, but the procalcitonin is supposed to be normal. However, there are discussions going on many of these things, but many times it doesn't come in our purview. Those who are managing the case, they usually will take the proper decision. And the chest X-ray and the CT chest are also required. I am telling you this information just to complete your knowledge about the disease. I am fully aware that you are not going to go into the detailed treatment of this particular child. The CT scan is more sensitive than the chest X-ray, and the ground glass opacities are taken importantly. And in case if there is bilateral pneumonia with normal to low WBC count, lymphopenia, normal procalcitonin, elevated CRP, and ferritin, they are suggestive of COVID infection. Okay, you should know which are the lab findings which are predictors of poor outcome. They are severe lymphopenia, elevated troponin, elevated creatinine, elevated LDH, and elevated D dimer. As regards management, remember, it is basically prevention of transmission to healthcare workers and the other patients, admission based on the protocols for that state or city, empiric therapy with antibiotics and with oseltamivir till diagnosis is established. Remember, I told you all that is coming to you. We have to be aware that it is not corona and corona. It could very well be H1N1, and it is our duty whenever a child comes to you for fever and cough going on for 5 or 6 days, then give oseltamivir till the diagnosis is established or otherwise. Give supportive care. Remember the role of hydroxychloroquine, the prophylactic role. The role of antivirals in children and hydroxychloroquine is not established. Under the age of 15, hydroxychloroquine is not given. And of course, steroids is not our area of discussion. Some of the experts, they give steroids in case of severe disease at an early phase, so that the further problems are avoided. And various drugs are given, particularly hydroxychloroquine, which has an action on the endosome and the pH. And there are various points related to the therapy as to whom to give, whether to do the ECG before starting dihydroxychloroquine or whether it is to be done daily, whom to give dihydroxychloroquine with azithromycin, if on dihydroxychloroquine and azithromycin, whether ECG should be done, how often, and we'll not go into the details as of now because probably we will not be involved in the day-to-day management of these patients. And is there any vaccine in the offing? No, as of now there is no vaccine. People are working on that, and there are organizations which are working on that, but there is still time for that. Of course, we hope the vaccine comes as fast as possible, but it's not something which usually comes very fast. This is because the virus affects the person in two phases, and just exactly what it happened in case of dengue. When the second phase begins, at that time these are immune enhancing antibodies, and people are worried whether you give the vaccine and the immunity is enhanced, then there would be a tough time, and that's why it's a major challenge. However, experts are working in this particular area. What about the baby of a COVID-19 positive mother? Please remember to continue breastfeeding. Do not deprive the baby of the breast milk. The mother should wear the mask and feed the baby. A small baby, I have seen pictures where, a small baby is also given a face shield and a mask, but it is, an individual discretion. At least mother must take all the proper precautions. And we doctors are in the front line. And as I told you, if you are personally ill, please do not go to the OPD, because patients will definitely understand. You ensure adequate sleep and rest, and don't skip your meals. Avoid stress. Stress will always release steroids and make you immunodeficient. So be calm and quiet. And as I told you, pray God to give cytokines enough to protect you and not to kill you. Okay. So, my dear friends, we will come to the end of this in the next few slides. Remember, majority of the infections in children are asymptomatic or mild. Use telephonic or digital consultation as much as possible. Quarantine the children. Even if the children are having fever and cough, see that they are at home. And this is important because children are known to be asymptomatic or carriers or amplifiers. So they should be quarantined. They should not spread the illness here and there. And remember, these children could be allowed to use mobiles and the TV when they are at home. And as far as possible, avoid children in contact with their grandparents, because grandparents come in the high risk group. Also remember to triage, means classify. In the OPD or the emergency room, all the children and parents must wear masks, use the personal protective equipment, hand washing and social distancing, minimal handling, for example, avoiding the throat examination and nebulization, and pulse oximetry is mandatory. The pre-existing illness in children has to be managed. Suppose if a child is asthmatic and he is, on inhalers, and you have to continue the management of asthma or whatever it is as it is. Continue breastfeeding and immunization. I told you, respiratory illnesses like pneumonia, they have to be managed as per standard guidelines, but tested for COVID. That means if a child is coming to you for pneumonia, please see that you usual medication whatever you are using, and guidelines for pneumonia management do not change. But at the same time, you better test the child for H1N1 and COVID. And remember, use CT scan judiciously, and microbiological diagnosis is preferred over imaging. Recognize, stabilize, and then refer the child. Okay. And beware of the fake news and the updates. Be updated on your own. Refer only to standard journals. And in situations of crisis, my dear friends, remember my name Pramod. Have patience. Ye din bhi jayenge. These days also will pass on. Don't worry. Patience and perseverance and positivity are very, very important. Be resilient. Have the capacity to rise up again from this particular crisis situation. Develop some skill, and develop art of survival in this particular situation. Be absolutely positive. Okay. And make others positive. Okay. This is an opportunity when you can minimize your needs. Now for so many days we are at home, but in case if at all nobody goes to the restaurant and the hotels and other places, you usually do not feel like going outside, and you have really minimized your needs. And organize your day, design your day, spend time with your family members, open the album of your marriage days if the memories have been comfortable, and then show it to your children and grandchildren if you have. And come closer to the family members. You, as doctors, we hardly get an opportunity to come closer to our family members. This is the best time that we can come closer to the family members. And let your children and grandparents, they know you thoroughly. Let them come closer to you, and let this be a permanent change. Okay. Not that it's only up to this lockdown period, but let this particular change be permanent, so that when you come out of this particular period, you are coming out as a better individual with a maturer, fully mature personality at the end of this period. And dear friends, the alphabet D in my name suggests, do not hesitate to call dear Pramod in times of depression. I have given my mobile number, and in case if there is any time that you feel depressed, do call me. Keep yourself updated. Stay home. Stay safe. Thank you. Remember, the word yes is important. It means yoga, exercise, service, and spirituality. Follow this. Remember, it's not a lockdown, it's a retreat. You are, as if on a retreat, think about your life, and read more and more about this disease. And I wish you all the best. Thank you again.
Thank you very much, sir. Sir, we would like to take a few questions.
Okay.
Yeah, I'll just read the questions. Dr. Gorika Bansal from Delhi has come up with a question. If a child comes with fever and cough, no history of contact or travel, when do we test the baby for COVID-19? If the child is not tachypneic and apparent and a stable child.
For an apparently stable child without tachypnea, there is no need to test for COVID unless there is a history of contact with a person with severe respiratory disease or pneumonia, or if there is history of contact with a COVID positive case. Only if the child develops tachypnea, then only you need to test the child for COVID-19.
Okay. Another question from Dr. Srinivas from Miraj. How long the virus remains live outside the body when it comes out as a droplet?
As a droplet, when it comes outside in the air, it survives for 4 to 6 hours. And as I told you, the various time limits up to which it survives on the surfaces. The least it survives is on the copper vessels, and that's why some experts advise the use of copper vessels for various things.
Okay. Dr. Uma Venkateshwaran from Mumbai has a question. How can standalone clinics work safely during COVID times?
I really don't understand what you mean by standalone. Is it the clinics which are run by pediatricians singly? Is it that what she wants to say?
Yeah, I suppose maybe that's what she wants to
No,
say.
actually, in case if there are colleagues who are practicing on their own, of course, whatever points I told about running a clinic, they could be extended and modified to this particular, question. If you are running a clinic alone, and if you are taking the care of your clinic alone, you can always put up, some notice outside the clinic and tell them to come at a particular time, and during that particular period you run the clinic accordingly, taking all the precautions of social distancing. See that if they queue outside your clinic, maintain a distance of 6 feet between two patients. You enter the clinic on time, and do it in a calm manner. Don't be in a haste to finish the work. Do it slowly and give a slot of appointment of 15 minutes, 30 minutes, depending on the number of patients. If you know the patients well, please see that you inform them on the mobile phone, and keep calling them at particular intervals. This is basically to avoid the close contacts and segregating the people. As I told you, many times I tell these patients to show the practitioners and the family physicians in their area. Basically, this is to confine the patients to their own areas. We don't want them to run around here and there and spread the virus. This is the basic reason. And as I told you, don't worry, the days will pass on very fast. Of course, people say that the practice is not going to be the same as it used to be earlier, but then this is change. And I would say change in life has to be very courageous to accept the change, and we know change is the only current thing in life. Okay.
Yeah, one more question. Dr. Manish from Gorakhpur wants to know, a young boy suffering from sneezing for 2 days with running nose and a fever, low grade fever at night. Is there a possibility of corona?
Acha, before I answer, am I audible?
Yeah, means to me I am audible.
Okay. Because I am getting a message saying that the speaker is not working, and someone wants me to check the connection. But if I am audible, I am happy. Okay.
Yeah,
Are you listening to me?
yeah, I'm just checking the messages if anything is coming.
I will
Okay.
hold on for a while.
Yeah. Yeah, I think. Yeah. There are many questions. I think what I'll do after I ask my question, I will mute myself so that I think the echo would not happen. So yeah, one more question from Dr. Narsimappa from Bangalore. Do we
Yes.
have any data of children affected by COVID in India?
As of now, the data is not available, but we will be able to give it by the end of this month. There have been cases in in the region, and number is not very great. However, the details of the cases in the we have.
Sir,
Dr. Varsha from
sir, your voice is breaking. Just speak slowly.
Yeah. Dr. Varsha from Mumbai wants to know, are we justified in charging for teleconsult?
Yes. In fact, there are various agencies which are helping you out in this. After that, and after the person agrees, then you prepare your consultation on a prescription. It's a regular e-prescription with your name, of the medicines, your e-signature, and then you request them to pay by any mode like Paytm or Google Pay. Once you know from the messages that you get that they have paid, then you can pass on the prescription to them. So it's very much legal, and MCI has made payment also a legal part.
Next question from Dr. Anupama Sagar. Children who are immunocompromised like nephrotics or asthmatics, do we give prophylaxis to such patients? Is there any role of vitamin D supplementation?
Remember, there is no role of prophylaxis, as I told you, because under the age of 15, hydroxychloroquine is not recommended. So even if the child is immunocompromised, if he doesn't have any illness, let him stay at home without any other thing. What was the second question, sir?
The second question was, is there any role of vitamin D supplementation?
Yeah, there has been a lot of discussion about vitamin C and vitamin D. Of course, there is nothing wrong, if you give vitamin C or vitamin D, because, for this particular virus, which has history of only 3.5 months now in the world, it's very difficult to predict anything as of now. But there is nothing lost if you give vitamin C and vitamin D, because both these molecules have been always linked with the overall increase in the immunity. See, many things are there which do not have a direct evidence. For example, a good diet, exercise, then having a good chat with the friends, remaining stress free, praying the god, and having a humorous attitude. So all these things are linked to a good health, and they are a part of general health, and there is nothing lost if you follow certain things. On the same lines, zinc also, basically it is available in the moongfali, that is the groundnuts, and that's supposed to be rich in zinc, so you can use that.
Yeah, one last question we'll take. Dr. Nitin Deshpande from Pune wants to know how to manage oxygen saturation of children patients, and because we don't have pediatric hand or battery operated pulse oximeters are not available in the market.
Okay,
So,
actually, maybe I have given you my mobile number, and in case if you want the details of people who distribute the pediatric probes, I will be more than happy to share with you. These pulse ox probes are available, and you please use them in particularly in children who have fever going on for 5 to 6 days. It will be prudent and wise to find out their oxygen saturation.
yes, sir. Yeah, thank you very much, sir. It was an excellent session. I would just like to make one announcement for the next program, which is going to be on Sunday before we log off. It's a program on insights in pathogenesis of COVID-19, implications in management of diseases. And the speaker is Dr. Neelam Mohan. She is Director, Department of Pediatric Gastroenterology, Hepatology, and Liver Transplantation, Medanta, Medanta City, Gurgaon. The timing is 5:50 to 6:30 p.m. on Sunday. So, friends, we hope to see you. We hope to seek your participation again in the CME on Sunday. And my sincere thanks to Dr. Pramod Yog for a beautiful, witty talk. And I hope the questions which are unanswered, we will get them answered. If there are still some few questions we may have left in this. Thank you all. Thank you all for your active participation and your keen listening. Thank you, sir.
Thank you.